The most dangerous sign of kidney failure isn't what you think. Most people wait for back pain or frequent urination to worry about their kidneys. But kidney failure is called the silent killer for a reason. By the time you feel pain, you've already lost 75% of kidney function. Imagine waking one morning feeling unusually drained, even if you slept 10 hours straight. Or noticing that your urine, once a clear and light hue, now appears frothy. What if every breath feels shallow, as if your body is fighting to draw in just enough air? Perhaps you felt an incessant itch that no lotion seems to soothe, or endured nighttime muscle cramps so severe they keep you awake. These aren't just isolated incidents. They are hidden, early warnings that your kidneys may be struggling to keep up with your body's demands. Waiting for dramatic symptoms like back pain is like waiting until the stream is almost completely clogged before taking action. Early detection is key, which is why understanding these hidden signs can make a life-saving difference. Before we dive into those eye-opening truths, we have a unique request, a little exchange of wisdom. We are here to share cutting-edge, evidence-based insights to empower your health journey. In return, we are asking you to share a piece of your invaluable life experience. Drop one of your favorite quotes. 1. Constant fatigue. When your body feels drained from within, have you ever wondered why, after a long night's sleep, you still feel exhausted? Constant fatigue is more than just a sign of aging or a busy life. It can be the first warning that your kidneys are failing. As your kidneys lose function, they are less able to remove toxins from your blood. These toxins build up, impeding the oxygen-carrying capacity of your blood and sapping energy from every cell in your body. Imagine trying to run your household on a generator that's slowly losing its power. Your house may still operate, but nothing runs as it should. In the body, this means that when waste accumulates, the delivery of oxygen to tissues is compromised. For those over 50, who might already experience less robust energy levels, this constant fatigue is easy to misinterpret, yet it should prompt a timely checkup. When the body is literally being poisoned from the inside, as the toxins build up, every task, every movement becomes a struggle. 2. Foamy urine, the telltale signal of protein leakage. Notice anything off about your urine. Foamy or frothy urine can be an alarming sign. Under normal conditions, your kidneys filter your blood efficiently, preventing valuable proteins from escaping. However, when the filters in the kidneys become damaged, protein begins to leak out, creating foam in your urine, a bit like witnessing your once pristine water filter slowly break down and allow impurities to pass through. For many, this symptom might be brushed off as a minor inconvenience or linked to dehydration. But protein loss isn't just a cosmetic issue, it represents a significant disruption in the body's balance. For those in later life, when the body's resilience is already reduced, protein leakage can exacerbate muscle loss and overall weakness. This is why a frothy appearance isn't something to ignore. It is your body's early cry for help, urging you to get your kidney function checked before further damage becomes irreversible. 3. Shortness of breath. When every breath feels like a struggle, many people reserve concern for shortness of breath as a sign of heart or lung issues. Yet, in the context of kidney failure, fluid overload is a key culprit. As the kidneys falter, they are less capable of removing excess fluid from the body. This surplus fluid can accumulate in the lungs, making each breath feel labored, as if you're inhaling through a wet cloth. Imagine trying to enjoy a peaceful walk in the park, only to discover you're carrying an invisible backpack filled with water. The extra weight changes your stride, your balance, and your overall energy. Similarly, as fluid continues to build up in your lungs, your body struggles to draw the deep, nourishing breaths it needs. For individuals over the age of 50, where lung capacity may already be diminished, this symptom becomes even more debilitating. Recognizing this early can allow for interventions that prevent the cascade of complications that come with respiratory distress. 4. Itchy skin everywhere. The unrelenting irritation of toxin buildup. Persistent, widespread itching might be dismissed as a dermatological issue or even a simple reaction to dry weather. However, when the kidneys are unable to filter properly, Toxins escape into the bloodstream and often find an exit through your skin. This causes a continuous, maddening itch that can lead to scratching until the skin is raw and irritated. Consider your skin as a canvas that reflects the inner health of your body. When overloaded toxins seep through, that canvas becomes a display of distress, each itch a stroke of alarm. For many seniors who might be battling various skin conditions, this symptom can be confusing because it easily overlaps with other age-related skin changes. Yet the intensity and persistence of the itch, unresponsive to over-the-counter remedies, suggest that something more systemic is at play. Addressing this could not only provide skin relief, but also lead to early intervention in preventing further kidney decline. 5. Muscle cramps. When your body's electrical wiring fails, muscle cramps, particularly those that strike during the night, are more than just a minor inconvenience. They can be a red flag, indicating that your body's delicate electrolyte balance is off-kilter. Your kidneys play a crucial role in regulating these electrolytes, which are essential for nerve and muscle function. When this balance is disrupted, it's as if your body's electrical wiring is shorting out, causing painful, involuntary contractions. Think of your muscles as finely tuned instruments in an orchestra. When the conductor, your kidneys, falters, even slightly, the whole performance becomes disordered. For someone in their later years, where nerve conductivity and muscle mass may already be compromised, these cramps can disrupt sleep, reduce mobility, and increase the risk of falls or injury. Recognizing muscle cramps as a sign of underlying kidney issues can prompt timely medical investigation, ultimately preserving overall health and independence. The underlying causes. A closer look at what's triggering these symptoms, it often isn't just one factor that leads to kidney failure. It is a confluence of lifestyle stressors, dietary habits, and the natural aging process. Over time, repeated exposure to high levels of sodium, processed foods, and inadequate hydration takes its toll on your kidneys. Likewise, chronic conditions like hypertension and diabetes, both common in individuals over 50, can silently worsen kidney function without overt symptoms until an advanced stage is reached. Imagine your kidneys as one of many gears in an intricate machine. When one gear starts to grind due to poor maintenance, the entire system eventually falters. This gradual degradation means that by the time overt symptoms such as back pain appear, significant damage has already occurred. Understanding this connection underscores the need for regular monitoring and a preventive approach to kidney health. Addressing these factors early can mean the difference between a manageable condition and a life-threatening crisis. Conventional medicine versus natural approaches. It is common to feel overwhelmed when hearing about kidney failure. Conventional medicine typically focuses on interventions like medication adjustments, dialysis, or even transplant in advanced cases. While these treatments are critical, they often address symptoms rather than the root cause. This is where natural and lifestyle-based approaches come into play. Natural alternatives emphasize nutrition, hydration, and stress reduction as part of a holistic effort to support kidney function. For example, many practitioners advocate for a diet rich in antioxidants and anti-inflammatory foods, like leafy greens, berries, and whole grains, while minimizing sodium and processed ingredients that burden the kidneys. This approach not only helps reduce toxin buildup, but also bolsters overall health, offering a gentle yet effective complement to conventional care. The philosophy here is not to replace medical interventions, but to empower you to be proactive with your health. Early detection. Why listening to your body matters for many of us, the idea that body signals might be subtle or misleading is a hard truth to accept. We tend to associate pain and severe discomfort with disease, but kidney failure proves that this isn't always the case. Early detection isn't about dramatic, alarming symptoms. It's about noticing small but consistent changes in your body's performance. Routine blood tests, such as measuring creatinine levels or calculating your glomerular filtration rate, GFR, become crucial here. These measures can alert you to declining kidney function long before severe symptoms emerge. If you've been experiencing unexplained fatigue, foamy urine, or any of the other signs we've discussed, now is the time to ask your doctor about these tests. Early diagnosis can open the door to lifestyle modifications and interventions that could preserve kidney function and improve your quality of life. Natural remedies and lifestyle recommendations for kidney health. Now that we've explored these hidden warning signs, let's dive into what you can do about them. A natural, supportive approach to kidney health centers on lifestyle changes and carefully selected natural remedies. Hydration and diet. Drinking plenty of water throughout the day helps flush toxins from your body. Aim for at least 8 glasses daily, unless advised differently by your physician. Pair this with a diet low in sodium and rich in fresh fruits, vegetables, and whole grains to reduce kidney stress. Herbal support. Certain herbal supplements, such as dandelion, turmeric, and milk thistle, have been shown to support kidney function. These herbs can promote detoxification, reduce inflammation, and help maintain a healthy electrolyte balance. It is essential, however, to choose high-quality, third-party tested products and discuss them with your healthcare provider before starting any new regimen. Regular exercise, gentle physical activity, like walking or low-impact aerobics, can improve blood circulation, which in turn supports kidney function. Regular movement also helps manage weight and control blood pressure, both of which are vital for kidney health. Stress management. Chronic stress can cause hormonal imbalances that may indirectly affect kidney function. Practices such as meditation, deep breathing exercises, and even yoga can help maintain a calm state of mind and reduce overall physiological stress. Integrating these natural remedies into your daily life, along with regular checkups, creates a proactive strategy, helping you combat those early signs before they balloon into something more serious. Answering your most common questions, you might be wondering, why am I experiencing these symptoms at my age? Or can these issues be reversed? Many people over 50 notice these changes with time, and it is not merely the result of aging, but rather a combination of factors including diet, lifestyle, and underlying conditions like diabetes or high blood pressure. While advanced kidney failure cannot be entirely reversed, early interventions can help manage the condition, preserve remaining function, and improve quality of life. Another frequent question is, what do I look for in a good quality natural product for kidney health? Look for supplements that have clear, evidence-based formulations with information on ingredient sourcing and third-party testing. This information is critical because it assures you that the product is both safe and effective. Additionally, timing matters. For many supplements, taking them with meals, as they are absorbed better with food, can make a positive difference. Always follow label instructions and consult with your healthcare provider, especially if you are taking other medications. Lastly, how long before I see improvements if I incorporate these methods? Results vary from person to person. Some may notice improvements within a few weeks, while for others, it may take a few months. The key is consistency. Adopting these healthy practices as part of your everyday routine often yields the best long-term outcomes. It's time to take these hidden signals seriously. If you recognize any of these symptoms, be it constant fatigue, foamy urine, shortness of breath, relentless itching, or painful cramps, don't wait for more dramatic pain to force your hand. Reach out to a healthcare professional and consider scheduling routine kidney function tests. Every step you take is a stride toward reclaiming control over your health. I encourage you to share your experiences and questions with a trusted friend or community group. Discuss these issues openly. By doing so, you not only empower yourself, but also help others recognize that they are not alone in this journey. Together, we can unravel the mysteries that keep our kidneys from reaching their full potential. Subscribe to health channels like us and follow experts who align with both conventional medicine and natural wellness. Your journey toward optimal kidney health is a shared one, forged in knowledge and supported by community. Your experiences, your questions, and your proactive steps are all part of a broader movement to embrace a healthier, vibrant life. Every minute you invest in understanding your body's unique signals is an investment in a longer, healthier life. The hidden warning signs of kidney failure might be subtle, but they are also your body's way of communicating that change is imminent. Embrace these clues with curiosity and resolve. With the right blend of modern medicine, natural remedies, and lifestyle adjustments, you can support your kidney health and prevent further decline. Remember, knowledge is power. You are never too old to reevaluate your health priorities, adjust your lifestyle, and make improvements that align with your well-being. Listen to your body, respect its signals, and take positive, informed actions. Your health journey is a personal one, guided by both the wisdom of modern science and time-tested natural approaches. You are not alone, and help is available every step of the way. This comprehensive examination draws on science, empathy, and practicality. It not only outlines the dangers of waiting for overt symptoms before seeking help, but also provides actionable strategies to address kidney health holistically. Your body's signals are not to be ignored. Embrace them, understand them, and use this knowledge as a catalyst for lasting well-being.